Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition today, also joining us on Comcast Channel 15 and AT&T Channel 99, we're joined by Birmingham Area Municipal Access. And on the radio in Bloomfield Hills and the surrounding areas, 88.1 WBFH, The Biff. As always, we're online, civiccentertv.com. Click on our Watch Live link at the top of the page, or watch us in a small player on the right side of the screen on our civiccentertv.com homepage. And as always, joining me in the studio today, and we're also on her journalist page via Facebook Live, is Ronnie Dahl.
Tyler, how was your weekend?
It was nice. It was a really nice weekend. Kind of a chillier one, but it was enjoyable. It was a nice, relaxing weekend.
Yesterday, though, the weather made me want to just lounge around the house.
Yeah, it did. It was pretty chilly out there yesterday. I was out for a little bit, and near about the 4 o'clock, 5 o'clock hour, it was pretty windy and chilly too. That was not a pleasant surprise. A little rain too, but overall, still a really nice weekend once again.
We'll take it.
Yeah, we'll take it.
We'll take it. It was nice to start to see the little buds on the trees.
Yes.
And the grass is getting a little green right now. So a couple more weeks, it's going to look nice.
Yeah, we're a couple more weeks out from this good weather being consistent here and spring weather being consistent in the area. But we're getting there, and we've gotten enough little glimpses of it to have some happiness, get out of the winter funk a little bit. But still a little ways to go before we're fully out of the woods.
So I will say I started yesterday because, you go out, you run a couple errands. I came home, started making dinner, and turned on the Nat Geo programming about Aretha Franklin. Have you watched that yet?
I have not. No, I have not. I've heard of it, but I haven't watched it.
So there's a lot of controversy about it. The family does not support the programming. And I'm about 4 episodes in, and I can see why. Because while Aretha Franklin was the queen of soul, behind the scenes, their life was a little bit of a mess. And obviously, her dad was a very well-known preacher. In fact, he was really a star before Aretha. But one of the things, and I think, everyone knew it, but it kind of played a role within the programming, was the fact that he did get a young girl, one of the members of his congregation in Memphis, Tennessee, pregnant when she was only 12. And so that played kind of a big part, but also his relationship with women and the partying and things of that nature that were going on as well. But, I mean, he was a very, very prominent preacher. And back in the day, they said that he would demand up to $4,000 for an appearance. And we're talking in the 60s and 70s. That's a lot of money for back in the day. That's how big he really was.
Yeah, there's a lot into the story of Aretha Franklin. Obviously, she was a huge star and a Detroit icon, but there's a lot more to her story and her family's story than just her successes and her journey. There are other journeys, of course, her father's. That's also very prominent in our local area because of Aretha Franklin. And Nat Geo covering that, they're trying to tell the entire story or give a broad base to the story of kind of how Aretha Franklin rose up into her career and became such an icon. But when you're telling a story like that, sometimes you go and you tell the full scope, and a lot of the stuff that's not exactly what you want to be highlighting gets out there.
Right. And, I knew that she was young when she was pregnant with her first child, but yeah, she was only 12 as well.
Right.
When she was pregnant. But I thought one of the interesting things, though, it's funny how we have these icons that live here in our community. She does live over here, or she did rather live over here locally in Turtle Lake, which is at Square Lake in Telegraph area. But one of the things that I found very interesting is she always carried her purse on stage because she demanded to be paid up front. And then it kind of became this symbol as well. And all of the years that we've heard these stories about Aretha, and she lived here in our community, I've never heard that story before. And then, it's just these interesting things that you find out.
Yeah, I mean, in those days, it was really easy to, it would seem it would be a lot easier to skip out on paying some of these artists, especially when they're up and coming and they don't have a big established name where they have that cachet to be able to say, no, you're paying me now or I'm not going to perform. Whereas, if they're still up and coming, the venue can say, well, okay, fine, we'll find somebody else. So in her case, to say, no, I'm going to get paid before I go up there, I know my worth, it again shows the power that she had early on in her career, because she was such a big talent and had such a big personality, and people listened when she spoke.
What a voice, though.
Yes.
I mean, really,
Oh, yeah.
really her voice was such a gift to all of us as well, because she was just one of the most amazing singers. And when you can sing like that, you can't be taught.
No.
That is just natural talent. And of course, they're still continuing to debate her will. It's in the probate courts here in Oakland County. So we'll see how that continues to play out over the next year or so.
Yeah, it's been a big story here, really since her death. What's going to be happening with her estate and where all those assets of hers are going to be going within her family and other places. And it's going to continue to be a big debate. When you have a lot of that money, a lot of that fame, and a lot of that focus on your family, and things aren't entirely clear in wills and so on, that can get really messy for any family, especially when you're in the limelight and there are a ton of eyes on you. Everyone wants to make sure they get everything right. So that's one of the main reasons this has been dragged out for so long.
Well, and I believe it's been also somewhat delayed. So
Right.
many court proceedings right now are delayed due to the pandemic. And, so many trials have been put on hold during this time as well, because the court systems, it's just not safe to bring people together. And how are you going to have a jury trial via Zoom?
Right.
So, we should get the new prosecutor on. I think we reached out to her before,
Yeah,
right?
we've reached out. We definitely reached out. We can reach out again and try some more to get her on. I think that it was just one of those still getting adjusted and getting in and not taking 30 minutes for an interview right away kind of a thing. But we'll get back in contact with the new prosecutor and try to get her on the show.
Yeah, that'll be interesting to see how they're going to continue. A lot of the courtrooms now are putting up plexiglass in between for the jury.
Yeah.
So more and more vaccines, though. So we're on the backside of this, hopefully. But, boy, the numbers continue to spike here in the state of Michigan. Spring break, though, that's really going to be a big issue. So many schools aren't even on their spring breaks yet. So combine the soaring COVID-19 case numbers here in Oakland County with spring break vacations, and it's not going to be a pretty picture. Dr. Russell Faust, Oakland County's medical director, said he's really afraid about spring break, because the numbers right now are 100 new cases per day on the daily average, higher than what we were a year ago. So remember what a year ago was like. Well, we are already 100 more cases a day beyond that. So it's about 300 cases a day here in Oakland County. So the 7-day average of new cases in Oakland County is about 401. That was as of late last week. So that's up from the 7-day average of 94 a month ago in February. So now there are about 401 cases a day in Oakland County versus just 94. So, and keep in mind, this just isn't here, Tyler. 7-day average positivity rate in the state of Michigan is 10.19%. If students and families go out of state for spring break, Faust does want to remind everyone they should quarantine for 14 days upon their return. And I don't know about you, I look at my Facebook feed and it seems like everyone is in Florida right now.
Yeah, a lot of people on spring break, and that was a big concern. That was a big concern that we brought up in the last couple of weeks of how's that going to impact this mini spike we were having, and now a pretty consistent spike in cases in Oakland County and in southeastern Michigan, really the entire state of Michigan. That's been a problem area for COVID over the last few weeks. And as more people now go on the spring break, because all these spring breaks are kind of protracted out, that only makes that that much more serious and makes it that much more urgent for people to take those precautions and be safe when they're out having fun. Go have your fun, live your life. You shouldn't put that on pause entirely. If you're going to be taking the necessary precautions, it should be just fine. But be careful about it, be smart about it, because we do have a spike in here. I was reading an article over the weekend with some numbers of the top 10 the top 10 highest COVID cases per city, and 6 out of those 10 are in the state of Michigan.
Yeah,
So
and you're talking nationwide.
Yeah, nationwide. 6 out of 10 of those cities are here in the state of Michigan. Several of them between 6 and 10, most of them. But I think the highest was Detroit at number 4, and I think we also had the number 1 or number 2 city as well. So Michigan having a lot of problems with COVID-19. I think if it was either Lenawee or Washtenaw County just went to a level E, which is the highest risk of COVID-19. I believe it was Lenawee, and Washtenaw is at a D. I'd seen from one of my family members that lives down that way. So COVID's still a big problem in Michigan, and as people come back from spring break, they're going to have to be a lot more careful with who they go around to prevent the spread of COVID-19. And while they're on spring break, be extra careful just for the fact that we do have such a problem in Michigan. And while it may not be a big problem in Florida or in Arizona or other places as it is here, you could be bringing it back and contributing to the problem here.
Well, and one of the big issues has to do with, too, the students come back, but then they're going to go back to college as well. Right. So there's additional travel in there. I think I saw one report, and they were talking about the travel over the past month has been almost back to normal numbers. And so the airlines are starting to add more and more flights because more and more people are comfortable getting on an airplane and taking off to warmer destinations.
Yeah, I mean, we're in the vaccination process. We're well on our way. Things are looking up. The projections are showing sometime in mid to late summer, we could be potentially out of this or at a point where we're getting back to some semblance of normal. I think that's getting a lot of people excited. And then on top of that, for the last year, we have been cooped up in our homes. We have been away from traveling and spending time with our family and our friends, and people are just getting itchy and eager to get back out there. And I think all that is contributing to this desire to go on these trips and go back on spring break and have these fun blowouts. And that's okay to a certain extent, but again, we just all have to be safe and responsible about it because we're still very much in this COVID-19 pandemic, and we have a spike here in the state of Michigan.
Some colleges actually canceled spring break this year because of just that, the concern of so many people traveling. So they're like, hey, we're going to cancel spring break. But so many of the schools aren't doing that to, the high schools, the elementary schools. So
right.
Spring break, I think around here, a lot of the schools are scheduled this week and next week.
Yeah, a lot of schools around here. I think West Bloomfield's currently on their spring break right now. You came in this morning, Ronnie, and there's no cars in the parking lot. Usually the only day that happens in West Bloomfield is on Wednesdays, which is their distance learning day in their current model, which is now finalized for the remainder of the school year. But it is their spring break. Other school districts have their spring breaks right around this time in the local area. So there's still a lot of these left to go, and a lot more precaution that's going to have to be taken by a lot of families and a lot of individuals, too, to prevent a further spike here in Michigan and in Oakland County.
I found this next headline a little bit interesting. The state now has to inform people that if you get the J&J, Johnson & Johnson vaccine, embryonic stem cells were used to make the vaccine. So when Michiganders get a Johnson & Johnson COVID-19 vaccine paid for with certain federal funds, a new state law mandates that they must be informed that it was developed using a stem cell line from an aborted fetus. So the requirement was tucked away inside a broader state bill that distributed federal COVID-19 funds. Although Congress approved billions of dollars for Michigan in December, it falls on the state legislature to allocate the money. The language in the bill states that anyone who receives a vaccine paid for through the $110 million appropriated in the measure shall be provided with information or informed if and in what manner the development of the vaccine utilized aborted fetal tissue or human embryonic stem cell lines. So it does not include language, though, rather, as to how the notification process is going to work, who's going to be required to notify the vaccine recipient, or who will enforce the requirement. So keep in mind, though, the process and the vaccines have been used for years, and it was used for the chickenpox, rubella, hepatitis A. They are all made in a pretty similar way, although those vaccines, you don't have to be notified. So again, I kind of think this is where some of our elected leaders get in their own way.
I would agree. I think if you're going to have to notify somebody of embryonic stem cells being used in a vaccine, it should really be across the board, or it should be not at all. I understand why in the case of the COVID-19 vaccine and in the case of many other vaccines, why there could be a requirement being put in place by the state in regards to informing people of embryonic stem cell usage. It still is a rather controversial practice, particularly for people for religious reasons. And a lot of people are going to potentially be in line to get the Johnson & Johnson vaccine that may have religious objections or moral objections or personal objections of any kind to embryonic stem cell usage as a scientific practice in the medical field or any field. And so if they're not notified and they get this vaccine and then they find out about that afterward, that's going to be something that makes them very uncomfortable and maybe even very offended that they were given a vaccine with these practices being used. So I understand why this is put in place, but I do think that because it's only being used in some cases and not in others, it's a little bit uneven, and it's another one of those, well, why this and not that? Complete the circle or don't try to draw one.
So the issue of our nursing homes continues to draw attention from some of the lawmakers. State Senator Jim Runstad of White Lake Township, we've had him on the show several times, introduced legislation last week that would fund a special investigator to look into the Whitmer administration's COVID-19 nursing home policies. Senate Bill 338 would designate funding to investigate the administration's nursing home policies, including the number of cases and deaths attributed to transferring patients to and from hospitals and whether patients died in the hospital or the long-term care facility. The measure comes days after Attorney General Dana Nessel denied a request to investigate the administration's long-term care policies. Runstad and Oakland County Senator Ruth Johnson, who is also a Republican, were among 8 Republicans in the Senate who asked Nessel to investigate. The Whitmer administration has said her orders, which, among other things, required the creation of dedicated coronavirus units within certain nursing homes and established those regional hub homes with COVID-19 wings, followed federal guidance. This issue is not going to be over for quite some time. We've had Charlie LaDuff here on the show before talking about this. He's been very passionate about this issue as well. And I think some of the confusion comes in when those beginning stages, they're saying, like when, a patient came from the long care facility and had to be hospitalized, if they passed away, those numbers weren't counted towards the COVID-19 deaths. And we had these big centers, like TCF Center was designated as one of these field hospitals for COVID patients, yet it really wasn't utilized, and it was millions of dollars wasted.
Yeah, and it's a huge concern too, because either the numbers are being unevenly allocated in terms of COVID-19 information, and which needs to be adjusted so that we can make those adjustments in our policies and we can know better for the future. And then on top of that, whether or not these policies did in fact have a severely adverse effect on people in nursing homes. I think those are valid questions that need to be answered. Whether the governor's policies that were put in place were directly a contributor to that or not, the nursing home situation during this COVID-19 pandemic has been extreme, has been severe, and has been frankly not been paid enough attention to, despite it being the biggest problem area in the state of Michigan in regards to COVID-19 cases and deaths, particularly early on in the pandemic, which is why we continue to have great journalists like Charlie LaDuff continue to dig into people on both sides of the aisle, while we continue to have lawmakers, particularly on the Republican side of the aisle, want an investigation, if not into the nursing homes, then into the governor's administration and her decision and their decision making, or both, because frankly we need answers on this. If nothing else, then to clear the confusion and understand where we may have gone wrong, what we may have done right, so that in the future when situations like this may or may not arise, we can make a better decision as the state of Michigan.
And so one of the things with that too is, it's like you said, it's so this doesn't happen again. And I hate to say it, as someone who had worked in the law enforcement community, politics does play a big role in some of these decision making. So I do think a special investigator, someone that it can be impartial, separate the politics between the two and really try to get to the bottom of this is exactly what we need. So we'll see if that passes, and we'll continue to follow that because there are so many people and so many families that really want answers.
And certainly there's a lot of flack being thrown at the Republican side of the aisle, who wants an investigation into the governor's practices during the pandemic and the nursing home policies and the effect that it had because of the situation in New York with Governor Cuomo and the fudging of the numbers, or the alleged fudging of the numbers in the state of New York. And maybe there's blood in the water that they smell, and that's certainly going to be something that's looked at as political. But even beyond that, looking beyond the political issues that may be in play here in terms of the nursing home policies during the COVID-19 pandemic, something went very wrong there. There were a lot of deaths. There were a lot of cases. It was very disorganized and mismanaged overall. And there needs to be some sort of understanding of why that happened, where it went wrong, and what we can do better going forward.
So, of course, you can always find the latest headlines. Go to civiccentertv.com, click on coronavirus. That's where we post the latest headlines. And what you also want to look there for the direct links to some of the websites to help you navigate this. I always like to check the Oakland County one.
Yes.
They do have a dashboard there, too, so you can kind of follow along and try to figure out what's going on with COVID-19 right here in your local community. We're going to take a quick break here on the show, and when we come back, we have a big lineup for you today on this Monday. We'll be speaking with the CEO over at the Judson Center, and then also 1040. Fredi The PizzaMan will be with us here on the show. I was so excited to see him get a bump and, a lot of business because of Barstool Sports when they were in town, but also he has a nonprofit that he runs on the side as well. And so that's getting a lot of attention as well. All that's coming up. And the 10 o'clock or 11, 10, no, it's only 10.
All of it.
In the Monday edition of the Megacast.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services. COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Monday edition of the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. You know, we're just over a year into the pandemic, and for some people, it's not getting any easier. It's been a roller coaster ride, and I always wonder about so many people with special needs that were struggling prior to the pandemic, and we do know that this past year has been tough. So many people suffering from addiction, struggling to get help as well. But there is help out there. That's the great thing about the community in which we live. And joining us now on the show, let's go ahead and bring in Lenora Hardy-Foster. She is the CEO of the Jetson Center. Thank you so much for being with us.
Thank you so much, both of you, Ronnie and Tyler, for giving me the opportunity this morning.
You know, it's the Jetson Center has been a part of our community, a much needed resource for so many people for decades now. But for those that may not be familiar with the work that you're doing over there, can you share your mission with us?
Absolutely. You know, we're a nonprofit that was started back in 1924. So celebrating 97 years right now, and pretty soon we're going to hit that 100-year mark. And over the years, when we first opened the doors, we were providing orphanage services for boys and girls. And we continue to expand, and we are probably one of the larger organizations in the state of Michigan that provides foster care and adoption and preservation programs for children. But in addition to that, over the many years, we continue to grow and expand. And today we provide services to adults that are disabled. We have an autism program, behavior health, and something that happened recently back in 2019. We partnered with MedNet One and brought primary health care into the behavior health practice.
So you have a lot of things that your organization is juggling right now. Could have been, stressful prior to the pandemic, but walk us through this past year because it's been stressful for everyone. Have you seen a surge in the need for your services?
Absolutely. There is a tremendous increase in the number of individuals, including children, adults, and families that are in need over this last year. We can understand, even for us who may right now feel as though that we're living a pretty normal life, the pandemic has been stressful for us. So you can only imagine those that may have other challenges. The increase in the need of services for them has it has increased. So we are here to provide those services. We see the increase in children in our autism program, the adults in our behavior health program, as well as children. And we've just added a substance use disorder program. So we are a SUD provider, and there's an increase in the number of individuals that are requiring those services as well.
So on the back side of that, we know a lot of places are struggling getting employees and trained employees. Are you able to keep up in that arena?
We worked very hard. When we were first, when the pandemic first hit all of us here in Michigan, there were things that we had never provided before. An example would be in the behavioral health program, telehealth. So my staff were not trained, nor did we have all of the necessary software and equipment. So we had to ramp up immediately. And I was so proud of the staff and my IT department that responded right away, made sure that we provided staff with all of the necessary tools that were needed so they could work remotely and still provide those much needed services. And even for those staff that had to come into the office, we are essential services. And there are some services that still require face-to-face. And so we just went out of our way to make sure we could accommodate all of the people that were in need and required our services.
Lenora Hardy-Foster with us here on the Megacast. She is the CEO for the Judson Center. And as you stated, you started off with foster care and adoption. What has this been like for the kids that are in the foster care system? Because are volunteers allowed to go in and help?
We do have some volunteers that assist us, but it has been very challenging in that program over this past year because most of the services had to be done remotely, through various virtual platforms. And when necessary, we were able to go into the homes, but it's mostly all of the credentialed and licensed staff that would actually enter the homes. And so it's a challenge in foster care. Just here in the state of Michigan, there are over 13,000 children in the foster care system.
Wow. And can you talk more about the foster care system? What is the process if someone wants to be a foster care caregiver, I guess? Is that the word that you guys use in that arena?
We're always looking for foster care parents. So there's a whole recruitment process that we follow. We're always looking for individuals, to participate as being a foster parent. And that's when we first start, even before we reach the adoption, because the number one thing is reunification, trying to make sure that we can reunite that child with the biological parents. So that is the first step. But probably one of the biggest challenges that we do have, and it's not just in Michigan, it is a national problem, and that is being able to recruit as many foster parents that are needed to accommodate the children. That's the reason over 13,000 are right now waiting on the list in foster care here in the state of Michigan.
Wait, you have 13,000 waiting?
over 13,000 in the state of Michigan are
Wow.
on the waiting on the foster care list. They're waiting to be placed in a home with foster parents. That's all a child wants. They want to feel loved. They want to make sure that there's some stability in their lives. And what happens sometimes is with some of those children, not all of those children, will end up hopefully being adopted by even foster parents or individuals that are seeking to be adoptive parents.
Right. And what's it been like with the system, like the court system as well? Because they're virtual and they're backed up as well, right?
Exactly. So, with the court system, we still continue to move forward processing adoption cases, but we have to wait for the court. So that has been a delay with the court systems being closed to really move the children much quicker through the adoption process because we have to wait for the judge to sign off.
Lenora Hardy-Foster with us here on the Megacast. She is the CEO for the Judson Center. Lenora, I'm wondering, what is your day-to-day like? It seems like you're juggling so many issues that impact so many lives.
We really do. And, in Jetson Center over these 97 years, we started in Oakland County, but we have offices in 5 counties. So we are in Washtenaw, we're in Genesee, Wayne County, and Macomb County. So it has really been very challenging this past year, to really try to juggle all the many services that we're providing, especially during this pandemic. But here again, I'm just so proud of the staff and all the hard work and dedication that they have done to make sure that we can continue to provide quality service to all of the children and families that are in need.
It's been a challenging year for so many nonprofit organizations. What is your budget looking like right now?
So, budgets for a nonprofit is always challenging. You're not guaranteed you have a grant, and you don't know if when we're going through these type of crises, if you're going to lose a grant, it may not be renewed. If you're not providing a service, you cannot bill to be reimbursed by Medicaid or through commercial insurance. So there's always many challenges, but what we do is we take a hard look at it. We do the best that we can in making sure that we can stay within the revenues that we anticipate to earn. But what has been the biggest challenge for us, being a nonprofit, you could be anywhere between 10 to 15% of your total annual operating budget is coming from fundraising, philanthropy, having events to raise money to help you close those gaps that you don't get enough money through grants to cover 100% of your costs. That has been the biggest challenge for us this past year, being able to sustain those dollars.
Yeah, and so I know a lot of people have had to get creative. They've tried to do fundraising events via Zoom and virtual. Did you try that at all, and did it work?
Absolutely. This past year, we had 2 virtual events. They were set up using the Zoom platform. And I am just happy to say that we were very pleased with the outcome. They were successful. We didn't raise as much money as what we have done when it is a in-person event, but we were very pleased with the people that supported those events. They participated on that Zoom platform, and the donations did come in at an amount that we ourselves was able to say it was a very successful event.
Lenora Hardy-Foster with us here on the Megacast. She's with the Judson Center. You guys do so much amazing work over there, but it can be stressful as well. This past year, as we said, it's been challenging, but has there been a silver lining at all? Something that you think has been a benefit that you will take post-pandemic?
Absolutely. Matter of fact, when the pandemic first began, we were notified by SAMHSA that we were one of 18 organizations here in the state of Michigan that we did receive the CCBHC designation. That stands for the Certified Community Behavioral Health Clinic. This is a program that our very own Senator Debbie Stabenow was very instrumental in being able to get that passed through Congress about 5 or 6 years ago. And so here it is, right? We're getting ready to start with the pandemic, but we received this exciting news that Judson Center was one of the 18, and it allows us to receive $2 million a year over a 2-year period. And that is to enhance our services within our behavioral health program. The timing was perfect because it allowed us to do some things that we would have never been able to accomplish. So we're so proud of that achievement.
And because do you anticipate that even on the backside of this, as we start to get vaccinated and get back to life, the mental health impact of the pandemic may linger with us for years to come?
That very well could be for a while, especially as we see the increase in the number of people that need these services. One of the biggest concerns that we do have here in the state of Michigan, as well as other states, is being able to recruit staff with the credentials to provide those services. There is a shortage. There's a shortage in finding licensed social workers that could provide those services. So we know that's a challenge that we're dealing with. Right now, there's a waiting list here in the state of Michigan of individuals that need and require those services.
Wow, that's so sad to think about. But it can be emotionally draining for an individual to work in your industry. I know that I had a girlfriend who went to work for social work. She, went into the industry for like a year or two, and then she just couldn't handle it emotionally and ended up getting out of the arena.
Absolutely, and that does happen. And think about during the pandemic too, that was already enough stress. And when you're dealing with providing these type of services, there are many challenges. It's very stressful. And so we're always doing everything that we can to be there and support our staff, to help them during these challenging times. But also there are times that there's a lot of good that comes out of the work that we're doing. We are so happy about a partnership that we've been able to create with the Salvation Army, their Harbor Light program that's located in Clinton Township out in Macomb County. And so we're able to work with them and bring medical services into their facility and also to assist them on the behavioral health side as well. So there's some good that is coming out of this. And then we think about all our other programs. Autism. Autism is a program right now when you think about children, and today there's 1 in 54 children being diagnosed with autism. And April is the month that we recognize autism. We say light it up blue. And so there is good that's still going on. And that's a big event that will take place during the month of April, just trying to raise awareness with everyone to just let them know, light it up blue in recognition of children right now that are diagnosed with autism.
1 in 54, that's an alarming number.
Absolutely. And, and that has happened over the last couple of years. A few years ago, it was like 1 in 60. And so the number is not getting better. It's not going in the direction that we would like for it to.
So for some of the families that are struggling right now, because we do know, especially with schools and classrooms, it can be hard for a person, a child with additional needs, such as, if they're autistic, for them to try to learn through a computer screen. So what are some of the services that parents can reach out to your center to try to get help with?
So one of the things with our autism programs are all face-to-face. So the children are back at all of the sites. We have 4 separate locations for autism. Back during the pandemic, when most of our staff were working remotely, the services that we were providing at that time for the autism families was more parent education. That was probably the best that we could do using any type of virtual platform. But immediately when things got a little better and we were able to reopen, all of the autism children are back. So it is face-to-face. And they're very excited to be back, to work with the team that works with them. And we're happy to have all of the children, back at each of those locations.
Lenora Hardy-Foster with us here on the Megacast. She's with the Judson Center. With that, where can people find more information about the work that you and your staff are doing, or also maybe if they want to donate?
Yes, please feel free to visit our website at www.jutsoncenter.org.
Well, we so appreciate your time, and thank you for all the work that you're doing as well.
Thank you so very much. Thank you.
Lenora Hardy-Foster, she is the CEO at the Judson Center. They have been a part of our community since 1924, and they have grown so much through their years to expand from their original mission of adoption and foster care. So we're going to take a quick break here on the Megacast. When we come back, we are trying to connect with the Pizza Man, but we're having a few technical difficulties, but we'll see if we can get him next here on the Megacast.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask.
Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders
Grocery delivery.
and shopping local.
Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together.
Together. For the latest information, visit oakgov.com/COVID.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Thank you for being with us here on the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. We were going to have Fredi the PizzaMan on, but we're having a little bit of trouble connecting to him, so we'll go ahead and jump to our next interview. You know, it is springtime. Opening day for the Detroit Tigers happens this week. And of course, the big news was that they're going to allow at least 8,000 fans into Comerica Park this year.
Yeah, that was an increase to 8,000. We'll see if that still stands with the current spike in cases in COVID-19. I know there's already some concern that the governor, via the MDHHS, may roll that back. Not anything from the state that indicates that, just from fans being concerned. But yes, increased to about 8,000 people down at Comerica Park. I'm sure there'll be a little more in that population if you count the people out and around Comerica Park for the general festivities, whether official or not, on the day of. But exciting news nonetheless.
Well, I will say the bigger and better deal if you're a baseball fan. Going to Comerica Park can be a hassle.
It can.
Getting into Detroit, paying for parking, and it's very, very expensive. One of the best things to do if you have a family and you like baseball is to go to Jimmy John's Field in Utica, the United Shore Professional Baseball League. I know that last year was tough for the league, but hopefully things are going to be better this year. Their hashtag this year, bringing back the fun. Let's hope so. Joining us now, let's bring in Dana Schmitt. She's the Chief Operating Officer for the United Shore Professional Baseball League. Dana, thank you for being with us.
Well, thanks so much for having me.
We're so ready for baseball.
We are too. We are too. And good news for us, actually. We've got a little bit more time than Major League Baseball because our opening day is May 28th this year. And so that's given us a little bit more time to get more people vaccinated. But you're right. We're bringing back the fun, and 2021 is our theme this year. And we're bringing back all the bells and whistles that make Jimmy John's Field such a special experience for people. It's great baseball, but we're going to have fireworks every Friday again this year. We'll have live music from our soundstage on Saturdays. We have fairy tale entertainment sends characters every Sunday. So we have our Sunday Fun Day for the kids. Just a ton of fun. We have a magician, Anthony Grappito, who performs 35 of our 5 games. So it's going to be great, and we're going to have about 1,000. Right now, our capacity limit is 1,000 at the ballpark. So on a typical game, that's about a third of our fans. For us, a sellout is max sellout is 4,500. So it won't be quite that, but it'll be much better than it was last year. It's going to feel a lot more normal. And we're hoping as the season goes on and maybe we get to midsummer that some of those restrictions that will still be in place, we anticipate by our opening day, will free up as we get farther into our season and into the summer months.
And do you think it will also help, at least from a family standpoint, they will feel more comfortable because you are an outdoor venue?
Well, that's been a big thing for us since this pandemic started. You know, we actually did play last season all of our games, and but we were limited to 100 people, and which was a challenge because we were outside. And so this year we have been, I would say, we have booked so many events even prior to our season starting because we're an outdoor venue and everybody is looking for something outside. So, you know, we're doing everything from high school graduations to proms and homecomings to award ceremonies for corporations. We're doing events for the Macomb Chamber and the Sterling Heights Chamber. Everybody's looking to do something outside where they can have an outdoor venue that's got a lot of room, a lot of space, a lot of rooms for social distancing, and then has all of the amenities built in. So we already have the restrooms. We have all the facilities there to be able to put these events on in a controlled environment where it's very safe. So, but we are going to be very, very busy. In fact, our first events start this coming weekend with college baseball, and it'll grow from there. And we'll be doing basically our entire calendar is almost full through October at this point.
Dana Schmitt with us here on the Megacast. She's the Chief Operating Officer for the United Shore Professional Baseball League. And looking at that throughout this pandemic, do you think you would be utilizing your space in all these different venues and avenues had the pandemic not happened?
I don't think so. So it's definitely things that we've never done before, because I think people were used to going to the same places that they had done these events at in the past. So certainly this has opened the door to do things that we haven't done in the past, and maybe people will have a great time and decide to continue to do those types of events at the ballpark. But I think some of these events will go back to their regular venue in future years when the pandemic's over. But it's we're certainly happy that we have a venue that we're able to accommodate people And even for things like these graduation ceremonies where, the kids didn't really get to do that last year. And so, we're happy that we're able to do something, even though with social distancing, there's still a limited number of tickets and things of that nature, because, it is a challenge once you have to social distance anything. But it is letting them have their ceremony and letting them have some family members come watch them graduate, for example. So it's a unique experience for us this year. But I think coming out of the pandemic, I think we're going to see a lot of happy, smiling faces at those events in addition to our games.
And we hope as well that then it opens up your venue and what you have to offer to the community. The baseball field and the setup there is really a beautiful space. For a baseball field, it's very family friendly as well. So hopefully you'll have more people come there, see what you have to offer, and then come back and enjoy the baseball season and the baseball field. And I know that you said, so you're opening the baseball season, it's going to be at the end of May. How are tickets though? Because with limited seating, do people need to get the tickets now, or are they pretty much sold out as well?
So right now we have not put individual game tickets on sales. We are only selling ticket plans at this time. We will put individual game tickets on sale, sometime in the next month in April. But right now we're still selling ticket plans, and we've had a big push for that because we do anticipate that many of these games with a capacity limit will sell out once we put individual game tickets on sale. And so the only way to really guarantee yourself that you will be able to come to the games you want to come to is to buy a ticket plan. And we have plans that start as small as 5 games. So a lot of people have been buying that and maybe locking in the games now, picking their games, so they'll be assured to be able to come to the games that they do want to come to. And then when we do put individual game tickets on sale, it's going to be a little bit different than it's been in the past because of social distancing. Those tickets are going to be available in pods, just like every other stadium and event like ours in the country. It won't be something where you can just go buy one seat. You're going to have to buy 4 seats together probably. And those are social distance throughout the grandstand. Not a lot we can do about that because we have to social distance our grandstand. And so this will be mapped out. And so everything from the lawn, you might have seen images of the Tigers playing in spring training with squares drawn on the lawn. Well, we actually did that same exercise last year. We thought we were going to have fans like this. So we already drawn our squares and we never got to do it. So, but that's exactly what we'll be doing. And the good news is that we can really space people out and socially distance, and 95% of our ballpark is outside. So we know it's going to be a great summer. It's going to be very safe. It's going to be fun. But we will, by the end of April, we will have those individual game tickets on sale, which will give us about a month before the season. But you still have time if you want to buy a ticket plan and lock yourself into, 5 games throughout the season where you'll be able to come. If you just call our box office, 248-601-2400, or go to USPBL.com, you can lock yourself into games now and be assured that you'll be able to attend.
Dana Schmitt with us here on the Megacast. She's the Chief Operating Officer for the United Shore Professional Baseball League. Dana, what's it been like behind the scenes for the players?
So we went through, good news for us is because we did play last year, we had to go through, even with that limited number of people, we had to go through all the protocols with our players. And we have, in the USPBL, we have 4 teams that all the players, we own all 4 of those teams. So we have, 80 to 100 players that are coming to Utica from all over the country. So it was a big process to get them here, have them tested where they were, have them tested when they got here, quarantine everybody until all of their test results came back, and go through a whole season of very strict measures that we took to ensure we could go through the entire season and never miss a game, which we did. I think we were probably the only league that had all of its teams play all of the games. So, but that was a lot of enforcing all of the things that we're telling that our public health officials have been telling us all to do: masking, social distancing. We did not washing their hands. The first thing the players did when they got to the ballpark is we checked them in. We did a health check. They had a mask on. They went straight to wash their hands, and then they only were allowed to go into the locker room 7 at a time just to change their clothes. And all of their food was eaten basically in the dugouts or in a to-go box. We didn't let people go in the locker room. So all of that indoor space, we really limited the amount of time and the number of people that were in the confined spaces. So it was very different for the players, and it probably took about the first 2 weeks of the season last year for them to get used to the process, but then they did. So the good news is for this year, we really are going to be able to hit the ground running because we've been through that process, and we'll have a lot of new players, but our protocols and processes, you know, we went through a full baseball season enforcing those. Of course, it would be great if all of our players were vaccinated before they get here. We don't have to do all of those things, but we don't know if that will be even a possibility for all of them because obviously they're younger people. And so, you know, I'm hoping that that's the case, but we're definitely prepared to go through and put in place all the protocols that we did last year to keep our players safe and prevent any outbreaks.
Yeah, that can be hard because when you have players coming from various states, every state has different rules and regulations when it comes to getting vaccinated. It's a lot to keep up with.
Right. I mean, you can't really get yourself too wrapped up in that because you can't control that part. You just have to take the information. You know, the good news for us is we've got more time before our players will be here. So that's one of the things we'll be talking about is who is in a state where they'll be able to get vaccinated, and, you know, what are we going to have to put in place? And if we don't have everybody vaccinated by the time our season starts, then we will have to use those same measures that we did last year. But obviously, the more that we can have our players vaccinated, it's going to make it easier for us all to navigate the season and let them get back to feeling more like normal. So we're hopeful for that, but we're also realistic, and we understand we may have to do the same protocols that we did last season.
So Dana, we know that there is starting to be a lot of talk around the vaccination and members of the public being required to be vaccinated to go certain places or do certain things. I think there are some venues in New York that are looking at this right now. Do you anticipate that's going to be a part of your conversation, or are you guys a smaller venue that you don't have to go there just yet?
So, I mean, that's not something that will be a requirement to come to a game at Jimmy John's Field. Obviously, there are a lot of people that have reservations, or they might have health conditions that prevent them from getting vaccinated. So that won't be a requirement, but obviously it'll certainly be helpful the more people in the general population that are vaccinated, where our number or our infection level comes down in the community, because anything like us, like a venue where people gather together, or a concert venue or anything like that, we need more people to be vaccinated so that the general public, that virus level comes down, so we don't have to social distance anymore or wear masks. That's what we all want to get to, but it won't be something that we will require, or even that we've discussed. I mean, if it was something that the state or the federal government required, that would be a different story, but it wouldn't be something that on our end would be a requirement.
What's it been like trying to come up with a schedule and worry about like the numbers increasing again here in the state of Michigan, yet you're planning for weeks and months out?
So last year it was a lot more difficult. We kept moving our date, and the stay home kept getting extended. And we started on July 3rd, and we normally would start the second week of May. Going into this year, we actually set opening day last fall in October. And what we kind of assumed is we just listened to everything that was happening. We normally would we pushed our opening day back 2 to 3 weeks from what we normally would have, because we anticipated the spike that was going to happen around the holidays and in the winter months. And then we anticipated that the numbers would start coming down in the spring and that vaccines would be available. And it's looking like that was a good decision to give ourselves a couple of extra weeks. And in the meantime, we've sort of filled in a lot of those dates with these other outdoor events at the ballpark. So the ballpark will be used, but it won't be, it just won't be for our games, but it'll be for other events. And so I don't anticipate at this time that we would need to change or move our opening day like we kept moving our opening day last year. I think that we feel pretty good about May 28th and that we'll have at least 1,000 people coming to the ballpark by May 28th.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. Dana, just another minute or two here with you on the show. Fingers crossed everything gets better and so much better than what it was last year. But as opening day gets closer and closer, can we talk about the revenue? And the revenue stream, what's that look like? Because at the end of the day, running a ball field like this costs money. And the one thing we don't want to see happen is lose such a great entity like Jimmy John's Field and the ball playing that's going on there. So how is the revenue looking?
So, I mean, this year is definitely not going to be normal again, because if we can only have, like right now, 1,000 fans, obviously that is an impact on us because that's far less than what we would normally have. So we can't have typical sellouts. Our sellouts will be at a much lower number. But we have budgeted for that. We've planned for that. That was something we anticipated. And we have been able to do things like take advantage of PPP loans, things that enabled us to withstand everything that happened last year. And quite frankly, we've been very fortunate that we have a lot of corporate partners who supported us through last season. So we are, it won't be the best year ever that we've had. I anticipate 2022 might be the best year we've ever had. So, so it'll be an impact, but we are not going anywhere. We made it through last year. We will make it through this year. This year will be better than last year. And then hopefully we get back on track to normal things, certainly fully normal, full capacity by 2022.
Fingers crossed. And with that as well, hopefully sometime maybe you can expand, because this really seems to be something that the public enjoys. Families enjoy this.
Families do enjoy it. I truly believe we're the best family entertainment experience in Metro Detroit. I see the smiling faces coming in and leaving our ballpark, and it's really a special place. We are working on trying to do expansion. I don't have anything to announce right now, but it's something that we're always working on. And hopefully something will happen, because I do think that it would be great to bring this to another community. And one thing I do have to say, we've had 38 players that have been signed to contracts by major league organizations into their farm system. And one of those players in 2019 made it to the majors with the Twins. And over the weekend, he signed a big contract extension, a 5-year contract for his first, big multi-million-dollar contract. And he started in the United Shore Professional Baseball League, playing for the Utica Unicorns in 2017. So for us, that was just so fantastic to see that we helped make that young man's dream come true.
And there are other dreams out there to be made to, come to fruition as well. It's such a great venue that you guys have there. Thank you again, and hang in there. It's like you said, get through this year. In 2022, there's going to be an explosion. Like after the roaring, after the pandemic flu, we had the roaring 20s.
Well, we're already booking things for next year, so I think that'll be the case. But I think this summer is going to be pretty good too. So not quite what it was, but it's going to feel a lot more like normal.
Well, Dana, thank you again. We always appreciate your time. Real quickly before we let people go, they can still get tickets, but they have to get them in those packets. Where can they buy those? Can you get them online?
USPBL, USPBL.com, and then the phone number is 248-601-2400.
Thank you, Dana. We appreciate your time.
Thank you so much.
Dana Schmitt with us here on the Megacast. She's the Chief Operating Officer for the United Shore Professional Baseball League. If you have not gone to a game at the ball field, Jimmy John's Field, you want to go ahead and try to get some tickets to do that, especially this year. If you're not comfortable going downtown to Comerica, this is such a great way to get in some family fun as well.
Yeah, a great way to get some family fun, good baseball also in a less crowded environment, more closer to home. Ease yourself back in. If you're not quite ready to go have the big ballpark experience, you can still have a great experience at Jimmy John's Field. And after talking to Dana and previously talking to Andy Appleby as well, we know that it's an organization there that is doing their part to keep a safe environment as we return to some semblance of normalcy as we approach the end of this pandemic.
We're going to take a quick break here on the Megacast, and when we come back, Fredi the PizzaMan is going to be with us here on the Megacast.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. You can always catch us Monday through Friday, 10 a.m. until noon. That's when we air the show live. You can catch us on Civic Center TV, Birmingham Area Municipal Access. Also tune us in, cable, channel 15 on Comcast, 99 on AT&T. And you can listen to us on the radio, 89.3 Lakes FM, 88.1 FM The Biff. I don't know about you, Tyler, but throughout the past year, the pandemic, pizza has been our go-to food.
Yeah, a lot of people, it's been the go-to food, and people have been exploring a lot of local pizza as well, because we have a lot of great pizza venues throughout the Metro Detroit area, in the city of Detroit as well. And as people have been at home and not wanting to cook as much because they've realized they're not very good at it, and they've gone back out to our local restaurants to help support them when they've needed our help as well.
Well, this guy is our next guest joining us, not only one of the best pizza makers in the world, but he also has a great cause as well. Fredi Bello, the Pizza Man, joins us now on the Megacast. Thank you again for being with us.
Thank you, guys. Good morning to both of you. Thank you for having me.
The most important question we have is, when are you going to open one in Oakland County?
Yeah, since the explosion, I've probably had 3,000 or 4,000 emails, direct messages, and I would say probably 100 people have asked me the same question, every city in the state of Michigan. So I'm standing right here right now. It's about all I can handle right now. I can say that.
Well, we will say I've had your pizza before. It's in you're located in Melvindale. It really is some of the best pizza. And before we get into the Barstool Sports and everything that has really kind of put you on the map nationally, let's just talk about this past year. How are you doing?
Business has been really good. To be honest with you, it's actually been busier. Which sounds strange when it's COVID. Where I'm located in Melvindale, I'm near Ford Motor. So many big factories and businesses that I always relied on the people coming from all over the state of Michigan to come down here to work, and they would find my place at lunchtime. Well, as many know, many of them are not coming down here anymore. And the fact that it got busier was kind of shocking to me, but it was business-wise an overall good year.
So, and With that, though, the employee front, we know so many restaurants are struggling getting enough employees. How are you doing in that arena?
Well, I've been okay with that, but many that know me, I'm a one-man show when it comes to cooking and making the pizzas. I've always been that way, at least for the last 10, 12 years. I kind of went that direction because I've been in the business 31 years. I used to have a lot of problems with employees. And one day I woke up and said, you know what? I'm going to turn this to a one-man show. And I did it. And I have a waitress and I have a busser. And I made it happen. And there was a lot of things that we could talk. It's too much to talk about. But I turned it into a one-man show. And I've been thriving with it for the last 15 years. Not anymore. It's not really a one-man show anymore. But some things change, obviously.
Well, Freddie, you have to pass your pizza-making gift along.
Well, for me, it's simple. I've been in the business. I've been making pizza for 41 years, 31 years in the business, 10 years as a kid with my father. And, I can remember 30, 35 years ago, pizza was kind of frowned on. It was just a pizza you get in a box, and that was it. We weren't considered chefs. And now you see the pizza explosion on the internet. People from home are making pizzas and shooting videos. It's the number one food videoed or photoed on social media, pizza. And now I call myself a pizzaiolo, that we're considered chefs. And for me, it's all about the love and the passion and the old school values when it comes to pizza. If you have those old school values and you have the love for it, you can make the great pizza. But if you don't, you never will make a great pizza. That's just how I feel about it.
How many pizzas do you think you make in a week?
I make a lot of pizzas. I open the door at 12 o'clock. I had to change my hours, and I sell out by 3:15 every day. The 5 days that I open, I sell out. So I sell a lot of pizzas in about 3 hours and 15 minutes. So
that is so amazing. But you know what, though? It's so great for us to hear from someone who is actually doing really well during the pandemic, because we know so many businesses and restaurants are struggling right now. So you're our light in this pandemic tunnel right now. And adding to all of this, of course, Barstool Sports comes in and you get voted best pizza. What's that experience been like for you?
Well, real quick, Ronnie, if you don't mind me backtracking, I think some of the businesses that have been peaking in the restaurant business or any kind of business, I think before COVID, if your business was already stable, you made it through COVID. If it was not stable before COVID, you weren't going to survive COVID. That's kind of how I feel about all that. Barstool, it's pretty simple. Dave Portnoy, he changed my life. I was really happy being here the way I was. Again, I turned my place to a one-man show, and that's the way I wanted it. And if many people that watched the video, I even told Dave, I said, Dave, you're really going to mess me up here. I'll be honest with you, because I know you're going to love my pizza, and I know that. And he obviously said that in the video. I'm ecstatic for all the fame and the notoriety and all that stuff, because I really believe the 41 years of doing this, it felt good to hear that. When you make something and you feel like it's really good, you want to hear that sometimes. Besides family or friends, you want to hear that from somebody that you don't know or doesn't know you. And it meant a lot. So it's changed my life. It really has. But what it's done for the foundation is really the number one goal for me, because pizza has given me everything in life. And people know me. I don't make pizza for money. I make pizza because I love doing it. But it's given me it's helped me make the foundation grow even more. And you can see from the video, $30,000 in donations in about 2 days. That was incredible, beyond incredible.
That is really, so many people throughout the pandemic, they really want to help. And so with that, the foundation, April is Autism Awareness Month.
Yep.
So tell us more about your foundation.
Fredi The PizzaMan Foundation was created in 2016, just with a simple little golf outing, just something off the top of my head. I said I wanted to do something to help sensory rooms in the state of Michigan. Obviously, my son was diagnosed with autism around 2015, and I knew nothing about autism. I learned a lot about autism through my wife, through the school she set my son up with. And I saw there was a need for sensory rooms. And the golf outing started, and my goal was to raise money and specifically meet with schools and buy them the equipment for their sensory room. So started one school, two schools. Next thing you know, I get letters from all over the state of Michigan. The foundation has done 18 schools in the state of Michigan, from Grand Haven to Frankenmuth to Monroe, all over the state of Michigan. And we've donated over nearly $45,000 in equipment. And we buy the equipment. We don't write them checks. We actually go into schools. I meet with the principal, meet with the teachers, and we buy them the equipment. Just outright. This way, there's no red tape, no nothing. They have the equipment and the kids can utilize it. And that's important to us.
So, Freddie, how old was your son when he was diagnosed?
He was about 2.5 years old. My wife suspected something about a year and a half, almost 2 years old, and she would talk to me about it. And we got the full diagnosis. And of course, you know, when it's your son or your daughter, it's fine. It's, you know, this is what God wants, and we're going to accept it. But I didn't know anything about autism. I really still don't know a ton about autism, other than being a dad and watching my son every day. And I know what families are going through. So for me, when I help a school, I know what it's doing for the child. And when you help that child, I know what it's doing for the parents when they go home. Because the sensory room was really good for my son. And he's almost 9 years old, and he's doing really well. He's doing really well.
So tell us about the sensory rooms.
Sensory room is it's a space usually attached with the classroom, and it has ball pits, it has trampolines, it has platform swings. You know, child with autism, you know, they're as smart as us, they know everything like us, but they think in a different way. They get to a certain point a different way than we do, and sometimes they have that meltdown. You get them into a sensory room, and they can get on that swing, and they can jump on the trampoline, and it automatically just it refocuses them, gets them back in the classroom, gets them back to learning, just like you and I did when we were in school, and all of us.
Freddy Bello with us here on the Megacast. He's the pizza man who, your pizza went viral after Barstool Sports came in and named you as the best pizza in the city of Detroit, in the Metro Detroit area. But you were all very well known even prior to that, at least locally.
Yeah.
But with the national attention, what has it meant for you with your foundation?
I mean, it's, you know, like I said earlier, it's $30,000 in donations in the first 2 days. The donations still come. Someone donated me the other day. My email went off and my PayPal link went off, and I look at them all the time, and you know, $10, $5. It was $1,000 donation 2 months after the video went out. And I can't believe it. I know how much hard work I put into it, and anyone that does fundraising knows that you're just not knocking on doors and asking for money. It's a lot of work. So I'm always so grateful when someone donates money, because I want them to know, hey, I run that foundation just the way I run my pizzeria. I'm making all the pizzas, and I want people to know, hey, that $1,000 is coming. That $1,000 is going to the school. So you're helping me help my family provide sensory rooms in the state of Michigan. So I think we're all in this together. That's how I feel.
I love that, because we are. But what's it been like for your son and some of the other autistic kids throughout the pandemic?
You know, I hear some stories from families. It's been tough. That's why this past Christmas, my wife and I, we donated almost $6,000 in equipment to build mini sensory rooms in homes. We came up with this idea to help these children, because obviously with the online and the Zoom, I mean, even today, I even had a hard time getting on the Zoom today. And these children, you know, it's a hard time being home. So we thought, get him a little mini sensory room at home. For my son, he's been okay. He's been, you know, you have your times, but, you know, ours is a little different. We have 2 little girls too. So they throw a wrench into everything too. So, he's been good. He really has been good. He's been doing great in school. I owe all that to my wife. I can't take no credit for that. My wife is fantastic with him. Make sure he's on top of everything. He's in gen ed, 2nd grade. So he's in with the other classes. And I do hear from my wife that, he'll have to go to a resource once in a while or speech therapy here and there, an hour a day. He doesn't want to leave. He doesn't want to leave his friends. He doesn't want to leave the kids. He loves it. So that makes me so happy. It really does.
So one thing out of the pandemic, because you're now getting national attention about autism, do you think this is going to help start the dialogue and keep it going in the months to come so that more and more families and more kids can get help?
I really hope so. I know my wife and I, we want that to happen. I posted the other day, it's much more than awareness. I think it's acceptance as well too. These kids, the kids with autism special needs, they just want to be accepted, just like you and I. So again, they may see things differently than we do, and they may go down a different path than we do, but we all come back to the same point. And we have, the word I want to use is we get all the perks to life but these kids, they don't have all the perks. We don't know what the direction is going to be when they grow up. Are they going to get married? Are they going to have kids or go to school and all that stuff? But accept them as everyone accepts us, because we're all the same human being. And that's, to me, the awareness is great, but I think acceptance is just as big. And I hope people really get that message, because I know a lot of families with children with autism, they just want they don't want anything. They don't want pity. They just want their son or daughter to be accepted in the world. Because, obviously autism now the numbers are growing every day. Even when my son was diagnosed 6 years ago, it could have been 80 in one. Now it's probably 40 in one. And I don't know the numbers. I don't know them offhand, but it's growing every day. So acceptance is big as too, Roddy. It really is.
And how much for their development, these sensory rooms and other ways of teaching autistic kids, how much of a difference does that make in their day-to-day lives?
It makes a huge difference. Just like everyone else, it does start at home as well too. Again, when I bring up my wife, I owe a lot to my wife when it comes to my son with the schooling. It does start at home, but they have the tools at school for these teachers. It's big for the kids. It's big for the teachers. And the earlier they have the development, ages 2, 3, 4, it's much better for them versus maybe waiting until 7, 8, 9. So I know the initial shock for a lot of parents when they find out their child has autism. Some will freak out, some will cry, some will. I understand that. We were in that position. We accepted it right from the get-go. We were saying, hey, this is what God gave us. But understand that it does get better every day. It really does. And sometimes you can't see that, but it really does get better. 6 years ago or 5 years ago with my son, there was a lot of thoughts in the back of my mind. I got to be honest with you. There's so many thoughts that are not there anymore. And that's only in 5 years. Things do get better. They really do.
Freddy Bello with us here on the Megacast. Freddy, how can people donate if they want to donate?
FrediThePizzaMan.com, the website. There's a donation link on there. It's 501c3, totally separate from the pizzeria. It's its own link, its own the charity link, 501c3 again. If you donate, just know that if you donate, you're part of this. That's how I feel, and you're helping us build sensory rooms in the state of Michigan. So you may not be affected by autism, but I'm sure you know somebody, and that child's going to need that help.
Well, we so appreciate your time and taking up this issue as well and making a difference for so many other families and so many other kids. Before we let you go, just between the two of us, what's the secret to a great pizza?
Great pizza is high heat with the oven. So the oven's got to be hot. So if you make a high heat, great pizza, and it's definitely the dough and the sauce. So I know a lot of people like to get a lot of stuff on their pizza. That's not a great pizza. You got to have very simple cheese or cheese and pepperoni and a great sauce. You can have a great pizza. You really will.
Freddy, it's been great having you with us. We appreciate
Thank
it.
you.
We know you've been extremely busy since you're now like a national star.
I got to be honest with you. I'm not going to lie. I'm embarrassed by it all. I really am. But you know what? If I have to make 1,000 pizzas in a day to help autism and other families, I'll do it. That's how I roll. That's who I am. So.
Well, you're definitely a gift to our community, so we appreciate your time as well. Fredi the PizzaMan with us here. If you haven't been by his shop, if you're downriver, please stop by. But get there early because the pizzas do sell out. Fredi, thanks again for your time.
Thank you, guys.
Okay, and best of luck, too, with the foundation, Fredi The PizzaMan Foundation. Please help support him and the work that he is doing. And what is so great about that, Tyler, is he is working directly with the schools.
Yeah, that is really nice because every school is going to have different needs. They know their students. They know what they need in these sensory rooms, and he's able to provide that help to them and directly to them. So there's not, like you said, that red tape to jump through. These schools are getting exactly the equipment that they need for their sensory rooms for their students as they need it in this time.
We're going to take a quick break here on the Megacast, and when we come back, sports. It's all about sports. This is the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Welcome back to the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Key. Big week this week for sports here in Detroit.
Yeah, big week. Obviously, last night the University of Michigan had qualified for the Elite Eight in March Madness, defeating UCLA. They won the game last.
Florida State.
Florida State. I'm sorry. I was watching the UCLA game. I wanted to say that was a really good one.
Although UCLA, they're doing well.
Yeah, and they're playing UCLA next, I believe. So. Yeah, great games last night, definitely. Michigan played an amazing game against Florida State. That's usually been a very good defensive team. And then on the other end, NBA trade deadline just passed last week, and the NHL Draft Lottery also coming up. So a lot going on in the world of sports, Ronnie.
Exactly. But really, I think the big focus this year is going to be how many people are going to get back into the stands and start attending these games. We do know, obviously, Thursday, April 1st is the Detroit Tigers opening day, which is really like a national holiday here in the city of Detroit. And 8,000 fans are going to be allowed to attend that. But as more and more people get vaccinated, you wonder how many people are going to be comfortable actually going to the games, because this is about revenue. And when you go to the games, I believe right now, you can't get concessions. Ansar Khan joins us now on the Megacast. He is the Pistons Red Wings beat writer for MLive. Thank you for being with us.
Glad to be with you.
So are you at the stadium now?
Yeah, I'm at LCA. The Wings are about to take the ice for practice.
So what's it been like for you as someone that is covering sports, getting back going to the games and getting into the stadiums. What's that experience like for you?
Well, it's much different than before. In addition to all the procedures that you have to go through just to get into the arena, you have to fill out a daily questionnaire about your health. Obviously, wear masks. You can only go. You go to the press box. The locker rooms are not open all across every sport. Everything is done by Zoom calls. So certainly a much different landscape than pre-COVID, and I would expect that they will at least start next season in the same fashion.
Ansar Khan with us on the Oakland County Megacast. He's a beat writer for the Detroit Pistons and Red Wings for MLive Media Group. And as we get closer, Ansar, to fans returning to the stands, well, now that they have returned to the stands at Little Caesars Arena, what are the rules that are in place in terms of how many people can come in and what the experience is like for fans at LCA, in particular for Pistons games versus Red Wings games, or a combination of the two if there's similarities?
Yeah, I believe it's the same. The limit for indoor arenas is 750 right now, and they have to be spaced out, scattered throughout the lower bowl. You'll see them sitting in groups of 2 or 4, or however many they came with plenty of space in between. Masks have to be worn throughout the game, anytime they're in the building. And concession stands are actually open, so there is that.
And while we're on the topic of LCA and you're there for the Red Wings practice, as we can hear the pucks dropping in the background, let's talk about a story you released last week on MLive.com about some controversy in a matchup between the Detroit Red Wings and the Nashville Predators, where referee Tim Peel was caught on a hot mic speaking about his intentions to call a penalty against the Nashville Predators, whether it was warranted or not. Can you give us an update on that? In your article, he was fired on last week, Wednesday, less than 24 hours after that situation. What went on there, and then what was the NHL's response, obviously resulting in his termination?
Yeah, that was a really bizarre incident, a bizarre story on many levels. Tim Peel was caught on a hot mic saying that a penalty that he had called against Nashville, his quote was something to the effect that it wasn't much, but I wanted to call a penalty at Nashville, which it really made no sense. It was the reputation that the referees have of evening up calls. Make-up calls if they felt that an earlier penalty wasn't warranted against a particular team. It's often said that they'll try to just have a make-up call later in the game. And this was early in the second period. I'm not sure what he was trying to make a make-up call for. And the other bizarre thing about that was he apparently said that to the Nashville bench, to a player on Nashville. He told him, which I can't figure out why he would say that. And the league really, I was surprised at how swiftly they acted. I thought maybe they'd take a few days to think about it and investigate, but they put the hammer down real quick. Of course, it made it a little easier in the fact that he was going to retire anyway in another month. So basically, they gave him early retirement, but they really had no choice after that debacle because his credibility would have been shot. I mean, any subsequent game that he would have worked, people would have said, wait a minute, did he make that penalty call just because he felt like it? Was it really warranted? Or, his integrity was just obliterated at that point.
And so, Ansar, did he have an explanation?
He has not talked, no. I've not, I don't believe, I've not seen anything, any comments from him regarding his rationale behind that move.
Obviously, we've had referee scandals before, such as this in the NBA previously, most notably with Tim Donaghy and other referees who were who were betting on games or involved in betting on games. Very different situation than what happened in this matchup between the Red Wings and the Predators. But from what you may or may not be hearing within either the Red Wings organization, because obviously it didn't happen to them, but it would be of a concern to them if it were to be something that was directed at their team rather than their opponent, or from within the NHL circles about any further investigations into other referees or other teams of referees that may be enacting similar practices to try to weed this out of the league? Or does the league take this as more of an isolated incident?
Oh, yeah, no doubt. Isolated incident for sure. The Red Wings, in fact, were very quick in defending the league, saying that they have no doubts about the integrity of the officiating, and even Jeff Blashill and Sam Gagne supported Tim Peel. They said they couldn't understand it. They said he's a good referee. They've always had a good relationship with him, and so they backed him up, and they were certainly surprised by the whole incident.
Yeah, definitely a surprise and something that you hope not to see any further of in any of these leagues, especially at the professional level where even the referees are the best of the best. Ansar Khan joining us on the Oakland County Megacast. He's a beat writer for the Detroit Red Wings and Detroit Pistons with MLive Media Group. You can read his articles online, mlive.com. And Ansar, while we're on the topic of the Red Wings currently 12-20-4. Once again, not one of the better teams in the league, at the bottom of the league right now. And as we're approaching the NHL Draft Lottery, what does it look like for the Red Wings going into this offseason with this particular draft? In the last few years, there have been some very hot prospects that if the Red Wings were able to move up in the lottery and get one of those higher picks, that they could potentially get a star-studded or potentially star-studded young player. Is that the case in this upcoming crop of players coming in?
Not really. I think most analysts kind of view this as a weaker draft class at the top relative to what it has been in the past. The big defenseman, Owen Power of Michigan, a lot of people project him to be the number one pick. As far as the Red Wings, I believe they are third from the bottom right now. And it doesn't look like they're going to finish dead last like they did last year, because of Buffalo's just a mess right now. So they won't have the best chance of winning the draft lottery. Plus, the NHL made some slight adjustments just a couple weeks ago to the draft lottery to make it a little bit more favorable for that worst team to get that first pick. So Red Wings will not have as good of odds of winning that first pick as they would have in the past, which never did them any good anyway, because the last four lotteries they dropped anywhere from 1 to 2 spots.
And what is the thought on that within the Red Wings front office, within the highest levels of the organization, because the lottery has been so unfruitful for them despite their position and been more favorable to other teams in similar or even better situations than they are in? Are the Red Wings frustrated with the current lottery system, especially now as it's going to be even more favorable for a team, for context, the Buffalo Sabres with 6 wins in comparison to the Red Wings 12?
Yeah, no, they didn't think it was equitable before, but they are in favorable of the changes, simply because it does favor, and it should favor the worst team. The worst team in the league should have greater odds at winning that top pick. Last year, in the previous system, the Red Wings that finished 23 points behind the next worst team last year, they actually had a better chance, slightly above 50%, of finishing 4th in the lottery, which they ended up doing, as opposed to only an 18% chance of winning it, and that's just not fair. And so the league has adjusted that a little bit to favor the worst team, and I think most people in hockey think that was the right thing to do.
Ansar Khan joining us on the Oakland County Megacast. He's a beat writer for the Pistons and Red Wings with MLive Media Group. You can find his articles, mlive.com. And Ansar, let's move on to the Pistons here in the next few minutes as we get toward the end of the interview. Trade deadline had passed, very quiet for the Detroit Pistons, but they made some moves to particularly bring in some younger assets and some picks as well. Trading, of course, Svi Mikhailuk to the Oklahoma City Thunder for Hamidou Diallo, a nice young swing man that's got a lot of potential to be a solid role player potentially for the Detroit Pistons, as well as the second-round pick. And then trading backup point guard DeLon Wright to the Sacramento Kings for Corey Joseph and a pair of second-round picks. Were there any other potential trades that the Pistons were considering, or any other goals that they had that maybe they weren't able to accomplish at this trade deadline? Or is Troy Weaver and his team satisfied with what they got at this trade deadline as they move forward in this rebuild?
Yeah, they're satisfied, but there was one other move that they had hoped to make. They'd hoped to trade Wayne Ellington, veteran shooting guard, but I guess from what I understand, teams were reluctant to give up even a draft pick, a second-round pick for him, because they figured that the Pistons might waive him and they could get him without sacrificing a pick. But of course, that didn't happen. And so the Pistons are, for now at least, keeping him. But yeah, that was, other than that, like you said, they got a couple of young pieces, a couple of draft picks. So other than that, they were satisfied with how things went at the trade deadline. Of course, this is a complete, as you know, just a complete overhaul. Troy Weaver's done in less than 1 year with Sekou Doumbouya is the only holdover, and he's really having a disappointing season, not playing much.
So, Ansar, if I can ask you, I know you're a Piston and Red Wings beat writer, but just came across the wires about the Detroit Tigers' new pitching coach. He's tested positive for COVID-19 and is going to miss his very first opening day here in the city of Detroit. An overall conversation, is there one going on right now with any of these teams about allowing fans back in and the possibility of requiring vaccinations?
Not that I know of. I think really it all depends on they get their lead from the state government. There's certainly, what is it? I believe it's 20% capacity in outdoor parks is allowed now. So the Tigers are able to have about 8,000 fans at their games. Still very limited to indoor arenas. Like I said, only 750 is very little. But whenever the state gives them the green light to increase capacity, they surely will do it. But as far as requiring vaccinations or anything like that, I don't think they're ready to go there. I mean, that you open up a big can of worms there as far as legalities and all that. I would think so. It would surprise me if there was anything done along those lines as far as that requirement.
Yeah, I think that's going to be the conversation, like over the next 6 months, over the next year. What about with players and members of the staff?
Same thing, as far as I know, no requirements of getting vaccinated. I'm not sure what the age requirement. I know for my age, it just opened up last week. I don't know for younger people whether or not they're eligible or not, but certainly going forward, once that age group is eligible to be vaccinated, I would think that these guys will all get their shots.
Ansar Khan with us. He's a beat writer for the Pistons and Red Wings with MLive Media Group. Just another couple minutes with you, Ansar. And obviously in the last few weeks, the Pistons reached a buyout with Blake Griffin. Blake Griffin then signed with the Brooklyn Nets. We've seen in just the last few days, LaMarcus Aldridge of the San Antonio Spurs also reached a buyout deal and signed with the Brooklyn Nets as well. They now have a handful of former All-Stars on their team in their starting lineup and on their bench. Andre Drummond, former Detroit Piston, waived in the last couple of days by the Cleveland Cavaliers and has now signed with the Los Angeles Lakers, where he'll be playing alongside LeBron James and Anthony Davis. There's been a lot of complaints, particularly in the fan community of the NBA about, and debate in the community around the NBA about this kind of a situation where players can be bought out, star players that maybe are not in a great situation and want to be somewhere else, but they don't have the contract to be moved. they can be bought out and then go to these teams that go from being super teams with 2 or 3 superstars to 2 or 3 superstars, a bunch of former all-stars that become super duper teams, for lack of better terms. I think it's fine because it's within the rules and players are going to want to play with who they want to play with. What are your thoughts on this current system in place, and does the NBA need to change some of these rules regarding buyouts to prevent teams from stacking the deck, so to speak, and messing with what might be the parity of the league?
Yeah, I tell you what, I don't like it. I didn't like, I think the formation of these super teams kind of started with back in the day, Miami with LeBron and Bosh and Dwayne Wade and now we're seeing it, with so many other teams like Lakers and last couple of years, the Nets, it really stacks the deck against, the smaller market teams, the teams that aren't, the places that aren't destinations. That's what made it refreshing a couple of years ago when Toronto won the championship. But yeah, I do think something needs to change in that regard to make it more equitable for, like I said, smaller market teams and places that aren't destinations. What exactly they can do about it, I don't know, because players have so much power in the NBA. But that is something I would like to see change. I'd like to see a little bit more parity in the NBA.
Yeah, it's something that's definitely going to be a hot debate in the months to come, especially as we approach playoff time, with the Lakers stacking up a little bit more with the addition of Andre Drummond, with, of course, the Brooklyn Nets adding a couple of former All-Stars in the last couple of weeks or so. It's going to be a hot debate as we head into playoff time next offseason and going forward in the NBA. Ansar Khan joining us on the Megacast. Thank you very much for being with us today.
Glad to be with you.
Appreciate it. Ansar Khan with us on the Megacast. You can find his articles online, mlive.com. We're going to take a quick break here on the Oakland County Megacast, and when we come back, we will wrap up this show with artist and activist Jax Blackmoore. You are watching and listening to the Oakland County Megacast on a family of TV, radio, and other media outlets.
Michigan, the coronavirus pandemic has put us all to the test, and now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you back with us here on the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. Just about 10 minutes left in the show. We just had the Ann Arbor Film Festival. So many great artists, so many creative people out there, and the pandemic did not stop their work. With us now, let's bring in Jax Blackmoore. She is an artist and an activist. Thank you so much for being with us.
For having me. I appreciate it.
So how was the film festival this year?
It was certainly different, but I think that there's just an incredible amount of work that really responded also to, the pandemic and isolation. So really relevant themes. So it was a joy to be part of, even if we couldn't be together in the theater.
I know, and that is a part of the experience, is getting that feedback from the crowd. So when you can't do that as an artist, as someone who is making a film that you hope to share a message with, how are you relating to the fans and the viewers without being able to be in a theater?
Yeah, well, I mean, I think that we're very fortunate in that we have a very active presence in social media today. So, regardless of the in-person experience, there's still a lot of people who are responding online. And in the case of my film, it's actually an installation, so it's not meant to be viewed inside of a theater. It's meant to be viewed from the street. So I've received lots of messages from folks that have been able to kind of walk by or spend some time with it in that capacity. So I was fortunate to be one of the rare filmmakers who actually got a physical installation and showing of their film.
Jax Blackmoore with us here on the Megacast. She's an artist and an activist. What's the past year been like for you?
Well, I mean, I think like for most people, it's been challenging, and I've certainly had to adjust the way that I work and respond to the world. I am used to kind of doing performances in public spaces and responding to the political climate in creative ways, but certainly mostly in person. So finding ways to connect with people and organize, and also learning to rest and to take care of oneself as kind of a revolutionary act, I think has been critical over the past year.
So with us, so many of us, we've been stuck at home a lot more this year than we have in previous years, but that's also kind of opened up our worlds because we are spending more time online or binge watching, documentaries or, shows on Netflix and this, that, and the other. So has it been good for you to be able to reach more people because we are kind of stuck at home now?
I mean, yes and no. I mean, it's a different kind of interaction. Typically my work revolves around designing kind of public experiences and kind of disrupting the normal day-to-day routine of that we experience in the public sphere. So it has been interesting to try to imagine the world online as a different type of public sphere, and how do we kind of get to meaningful interactions and have conversations of depth online. But I think that we actually are getting there, and I'm noticing that there's dance parties online, and there's reading clubs online, and there's viewing parties online. So all of that, I think, is starting to come around, despite the fact that we still do very much need that kind of personal interaction face to face.
So what's it been like for you to try to have to make a film during this time?
Well, fortunately, my film, it's a 24-hour film in duration. So it was filmed several years ago, and we've been editing this whole time. So actually being forced to kind of stay indoors has been helpful to assist with the editing process. But, the idea that it's experienced with people outside walking around has certainly minimized, most likely, the interaction that was intended and built to receive. But that's not necessarily a bad thing. This is one of many showings, hopefully.
So you are very well known for your activism and getting involved and trying to just, like you said, disrupt the way we think about so many things in life. It's been a crazy year, not only with the pandemic, but with the election. And then we've seen a lot of protests and riots throughout the country over the past year. How has that played into any future work, that you want to do, or any future filmmaking and trying to document this time in which we're living right now?
Yeah, I think that my work has been, rooted up until now in a sense of inequity and trying to expose where those weaknesses are and have conversations about how to make that something that we can interact with. And, there's now a whole world of people who are being active on the street who weren't before, and coalitions of support working on various different issues that ultimately intersect. So from that perspective, I think that there's a lot more people ready to kind of, get their boots on the ground and work together. And I also think that there's been a lot more innovation as a result of the pandemic that we've seen in terms of the way people are organizing and gathering and staying safe. I know I attended several protests that were by car, kind of everybody's honking their horns outside of a city council member's office, asking them to take action on a particular issue. So I think that it's amazing because all forms of resistance are needed, and all forms of kind of communicating our needs is necessary, and we should be creative and inventive.
So with that, tell us about this latest film.
So the film is called An Undue Burden. It's like I said, a 24-hour film, and it's really an endurance piece. Essentially, it features a woman who's waiting in a hotel room for 24 hours. But the purpose of the film is really to ask us to reconsider the impact of anti-abortion laws, and especially waiting period laws. So in Michigan, we have a 24-hour waiting period that's mandated by the state if you want to receive an abortion. And, a lot of people say that this is, not really a big burden. Like, what's the big deal if you have to wait? Well, it is a big deal if you consider the folks that need to obtain abortion procedure. It requires often that people travel, sometimes hundreds of miles one way. They have to get a hotel. 60% of people who obtain abortions are already mothers. So that means they also have to secure childcare. And on top of all of that, these laws, especially the waiting period laws, don't actually impact the rate of abortion. So they're ineffective. So I think that what I'm trying to communicate is that it causes a lot of harm without actually achieving the goals that it was set out to do. So how can we reduce the amount of harm and support women who are both pregnant or seeking to terminate their pregnancy, and do it in a way that is, that doesn't involve shame and guilt and further pain and hardship.
So throughout your filming of this film and the editing, what did you take away from learning about all these rules and regulations that have been put in place, not just here in the state of Michigan, but across the country as well? Yeah.
I mean, it's, reproductive health access is subject to volatile partisan politics, influencing the availability and accessibility of services that we have a legal right to. And I think that, especially under Trump, who has had done the work of imposing, putting a lot of conservative justices in place in a legal system that's supposed to be nonpartisan, shows that there is a real attempt by people in power to manipulate and control our reproductive system, but also to do so in the endeavor of gaining votes. So, it's a lot less about we care about the sanctity of life, so-called, or we care that women receive good health care. It's actually about playing into partisan politics and attempting to do that to woo conservative voters. And that's something that I think, given the amount of harm that anti-abortion laws, the amount of harm that they cause, the amount of distress, the financial burden, essentially forces many women to carry pregnancies to term that they don't actually want to carry to term, which disenfranchises them and their child. And it's not good for families. It's not good policy. We already know how to reduce the abortion rate through comprehensive sexual education, through access to birth control, ensuring that women have access to opportunities like education and a job. And so the fact that we don't invest in those policies, but specifically try to shortcut it by imposing all of these restrictions that only cause harm, I think my takeaway from all of the research is that we are not doing a good job of taking care of women and families. And it is necessary for us to call out those in power and to call what they're doing as manipulative and a power grab rather than actual care for our communities.
Yeah, it really is amazing that so many insurance plans will cover Viagra, but they will not cover birth control. Jax Blackmoore with us here on the Megacast. She's an artist and an activist. Just about another minute with you here on the show. How can people find out more about your work, and what do you think is next for you?
Well, you can visit my website or any of my social media accounts. It's just jaxblackmoore.com. You can also learn about the film through the website. And I have several, I'm excited to continue making films and kind of delving in the world of theater. And so I hope that folks will stay tuned. The film will also hopefully be available for viewing in Detroit this fall, as well as online. So just stay tuned and follow my social networks, and you should be able to figure out when that is and how you can participate.
And we hope theaters reopen soon.
Yes, definitely.
Well, Jax, it's been so great having you with us. We appreciate your time, and also good luck on your next projects, and stay passionate. We need people such as yourself here in our community to wake all of us up.
Thank you. I appreciate it.
Jax Blackmoore with us here on the Megacast. She's an artist and an activist. Her film, the Ann Arbor Film Festival, always a great event here in our community. That's going to pretty much wrap it up for the Monday edition of the Megacast, Tyler.
Yeah, it is. It's going to wrap it up. We got a great crop of shows coming up the rest of this week. Of course, tomorrow night, 7 p.m., well after the Megacast is done, we'll have our 3rd annual and first virtual State of the Communities as well.
That's always a good programming and one to be informed. So we'll be back tomorrow, 10 a.m.